time, I would like to read a public comment. Any citizen desiring to address the hospital board should turn in the speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel that is comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. And now, I just want to note that Mr. Henry has been excused from in-person attendance for health reasons. And I'd like approval of the orders of the day. Can I have a motion?
Second.
A motion and a second. All those in favor say yes.
Yes.
Any opposed? Motion passes. Thank you. And now I'd like approval of the minutes of the meeting of May 16, 2022. I have a motion and a second. All those in favor say yes.
Yes.
Opposed? Motion passes. Thank you. There are no board reports. However, I do have medical staff reports, and there's no joint reports. Dr. Lichtenstein does have a report. And so, Dr. Lichtenstein, would you like to start?
Thank you. In your packet, you will find the recommended delineation of privileges for the SMH-CS cardiovascular disease privileging. We ask for the approval of this staff delineation of privileges.
We have a motion and a second. All those in favor say yes.
Yes.
Motion passes. Thank you. Next, we have the Dr. Fiorica is giving the report for Dr. Jefferson. Dr. Fiorica, please.
Yes, I ask for a motion approving the Sarasota Memorial Venice cardiovascular disease privileging form as recommended by the SMH-Venice MEC and the amendment to the SMH-Venice rules and regulations and admission guidelines as approved by the SMH-Venice bylaws.
We have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Motion passes. Thank you. We have our Venice report by Dr. Fiorica, which you just gave. Thank you. And next we have our secretary's report. Greg Carter, secretary.
Thank you, Madam Chair. The board meets again on Monday, July 18th, and from 9 until 10:30 we have joint finance and audit committees. At 10:30 until noon is the quality committee. Noon until 12:30 will be closed session hospital board meeting. 12:30 to 2 will be financial review board issues and lunch. And from 2 to 4 will be the board meeting. And that concludes my report.
Thank you, Mr. Carter. And next we have our treasurer's report. And Greg Carter will give that report as well, please.
Thank you, Madam Chair. Our item summary and approval of bad debts and charity care, and I move approval of bad debts and charity care for the month ending May 31st, 2022, in the amount of $22,001,000.
Second.
We have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Thank you, Mr. Carter. Next, we have our financial highlights with William Wilchin, Chief Financial Officer.
Thank you, Madam Chair. And I have the highlights for the month of May and the fiscal year-to-date numbers represent 8 months of activity. We'll start with total revenue for the system in the rating agency format. For May, we had revenue of $124,147,000 compared to a budget of $115,635,000. Fiscal year-to-date, total revenue of $985,044,000 compared to a budget of $900,924,000. Going to a look at total expenses in the rating agency format for the system. For the month of May, $115,910,000 compared to a budget of $108,122,000. Fiscal year-to-date, again, this is for 8 months, total expenses of $921,581,000 compared to a budget of $849,603,000. Looking at operating income, for May, $8,237,000, which generated an operating margin of 6.6%, compared to a budget of $7,513,000, and we budgeted for a 6.5% operating margin. Fiscal year-to-date, operating income $63,463,000, operating margin of 6.4%, compares favorably to the budget of $51,321,000. We budgeted for a 5.7% operating margin for 8 months. Looking at statistics for the hospitals, we'll start with the average daily census. Total, and these are fiscal year-to-date numbers. Average daily census of 757 patients per day compared to a budget of 721. The Sarasota campus has had an actual average length of stay of 4.94 days. Last year was 4.68. And Venice, through the 8 months, has an average length of stay of 3.98 days. For a combination of admissions and observation cases, so far we've had 41,914 compared to a budget of 40,787. And looking at surgery cases, the 3 months, 18,596 compared to a budget of 19,207. And births, we've had 2,847 compared to a budget of 2,924. Continuing with statistics, outpatient registrations in the hospitals, 357,320 compared to a budget of 353,017. Combined emergency care center registrations, 98,147 compared to a budget of 97,613. Our case mix index for 8 months for all patients at the Sarasota campus, 1.95, and for Medicare patients at the Sarasota campus, 2.44, and at Venice campus, all patients, 1.49 case mix index, and for Medicare patients, 1.48. Madam Chair, that concludes my report. This was meetings.
Any questions for Bill? Thank you, Ms. Wilchin. Next on our agenda are our committee reports, and we have Greg Carter, Chair of the Mission and Planning Committee.
Thank you, Madam Chair. The Mission and Planning Committee met this morning. There were 3 presentations given to the committee, 2 updates and 1 improvement. The first presentation was the Sarasota Memorial Hospital Sarasota Cardio Oncology Program. Amber Taylor, manager of cardiovascular diagnostics, and Dr. Mark Reynolds, co-medical director of the cardio oncology program, presented on the evolution of cardio oncology facilities. Since opening in 2019, cardio-oncology patient volume has continued to grow, now seeing over 400 cancer patients per year. The cardio-oncology program is one example of an offering that will allow patients to not need to leave Sarasota to be provided the highest level of care. Next, Pam Whiteley, Executive Director of Women and Children's Services, and Happy Olson, Clinical Manager of Labor Delivery, presented the SMH Sarasota OB Expansion Project. In the past 5 years, SMH Sarasota has seen a 15% growth in births due to simultaneous growth of new patients in the emergency care center. OB ECC gave up half of their capacity in early 2022 for acute emergency services. The OB expansion project includes renovating the existing labor and delivery unit and 4 additional labor and delivery rooms to increase capacity. The project will also allow for increased efficiencies for the obstetrics, obstetricians, and nursing staff, while also enhancing the patient experience for labor and mothers. The 4 new patient rooms are expected to be complete in May of 2023. At this time, I move approval of the funding for the OB expansion project in an amount not to exceed $2,725,000 to expand OB capacity at SMH Sarasota and to add such amount to the existing fiscal year 2022 capital budget as recommended by the Vision and Committee.
We have a motion and a second. All those in favor, please say yes.
Yes.
Any opposed? Hearing none, motion passes.
For the last presentation, Lisa Heimel, Director of Pharmacy at SMH Sarasota, and Kathleen Truelove, Consultant Pharmacist, presented an expanded pharmacy services at Sarasota One Healthcare System. The pharmacy team plans to expand pharmacy services, retail offerings, using a phased multi-year approach. The panel reviewed the phased implementation plan, provided detail about the first phase of the project, the employee pharmacy. The employee pharmacy will be located within SMH Sarasota, will be available by courier and service any Sarasota Memorial Healthcare System employees or employed medical staff members that are covered by the SMH Health. Employee pharmacy is expected to open in spring 2023. And that concludes my report.
Thank you, Mr. Carter, for that. Next on our agenda is our President's Report with Jacob Behringer, President and CEO.
Thanks, Madam Chair. I am going to start, like I do each month, with our organizational report card. And so I will be looking at the 5 areas of focus: service, people, quality, finance, and growth. And I will start with service. We have a goal of having our 8 out of 10 of our departments that we survey being at 75% or greater for likelihood of recommending. I'm happy to report we're hitting at 9 out of 10 at this point in the year. I'll show you the detail on that here in a minute. The next area of focus is the people. We have a goal of having our new hire retention, which is a percentage of regular, full, and part-time employees that have been hired in fiscal year 2022 that are still employed as of September 30th, 2022. We have a goal of having 83% of those being retained. We are currently at 87.06%. In the quality section, we have our goal of having our combined overall standardized infection rate being less than 0.85. Happy to report we are exceeding that at 0.72. Just to remind the board, the national average or expected is 1.0, so we already set our goals fairly low and aggressive. Finance area, as you heard Bill Roach, our CFO, report earlier, we have our operating margin from our rating agency format at 5.5%, which is our budget. We are projecting to exceed that at this point at 6%. And then finally, in the growth area, we have two looks in growth. The first being inpatient admissions and observation outpatients, having a goal of being 60,119. We are slightly above that, or trending above that at this point at 61,809. The other one is outpatient registrations. We have a goal of being 1.125 million, and we are trending to exceed that as well, 1.139 million. Looking at our patient experience report card in more detail, what you have on the left-hand side are the 10 different areas that we survey for likelihood of recommending. The middle number is the score that our organization received. The next score over is the national median score, which we have 10 out of 10 of our areas meeting that or exceeding. And then finally, we have the 75th percentile score, which is what we base ourselves on. And we do have 9 out of 10 of our areas exceeding that. First physicians group being 1 point away from being there as well. So I'm very proud of our organization. Next up, you may have read this in the paper or seen it in our announcements. But we have named a new CFO that will begin here in October 3rd. Jeff Lombacher, a healthcare executive with more than 20 years of financial leadership, will become Sarasota Memorial Healthcare's new Chief Financial Officer, effective October 3rd, 2022. Jeff will succeed Bill Ocean, who is retiring December 31, 2022. Bill has served SMH for 15 years and will remain a key member of our executive team as he guides and advises Jeff through the transition. Our new CFO comes to us from Baton Rouge, Louisiana, where he's worked in leadership roles with Franciscan missionaries of Our Lady of Lake Health System since 1995. He served as Executive Vice President and Chief Financial Officer of the not-for-profit multi-hospital system for the past 3 years. SMH-Venice marked 6 months of success and start of expansion. Sarasota Memorial Venice recently celebrated a successful 6 months since the new hospital opened in November of 2021. The 110-bed facility is already planning to expand to 178 beds within the next couple of years to accommodate the huge demand for care. Venice 6-month stats since opening in November of 2021, we've had over 16,000 ER visits, 5,300 plus patients discharged, 1,374 OR cases, 65 babies born, 1,000 medical staff members, and nearly 1,000 employees. Our new campus earned Stroke Center designation. SMH-Venice recently earned designation as a primary stroke center from DNV Healthcare. The new hospital completed a rigorous on-site survey and met or exceeded requirements from the state of Florida and the National Accrediting Organization for Advanced Stroke Care. SMH-Venice is the 3rd facility in our health system to earn stroke designations. SMH Sarasota is nationally designated Comprehensive Stroke Center, the highest designation. Our freestanding emergency room in Northport recently received designation as an acute stroke ready center. And all 3 campuses follow the same emergency care protocols to diagnose and stabilize patients experiencing stroke emergencies. The ECC welcomes with a new front door. SMH Sarasota recently completed the first phase of the renovation of the emergency care center's entrance and waiting area, part of a project designed to improve patient flow in the ECC's clinical capabilities. The next phase of the project, scheduled to finish in the coming weeks, will bring a new waiting area devoted to pediatric emergency patients with kid-friendly design elements to help ease children's fears of visiting a hospital. The project's 3rd phase, slated to be completed this fall, will create space for 2 new CT scanners. Many thanks to the ECC team and the many other departments, leaders, and staff for their expert planning and implementation and efforts to ensure our busy ECC remains operational through the project. I'm appreciate a lot of the board members who came out for the opening day too. Thank you very much. Anniversary celebration salutes our longtime staff's stellar service. Sarasota Memorial recently held a celebration to honor the dedication and contributions of 800 employees who recently recognized special service anniversaries ranging from 5 to an incredible 5 decades. I do want to just point out one is the picture there on the far left, SMH's longest serving employee, Lenora Yoder, with over 50 years of service. We really appreciate everything that she's done. COVID-19, a time to stay vigilant. With opportunities for summer travel ahead and cases on the rise, it's important to take precautions and stay safe. We encourage everyone to keep up to date on vaccines and boosters and stay home and get tested if feeling sick. It's also important to learn about potential treatment options. A number of outpatient antiviral therapies are available for people at higher risk of becoming severely ill. To be most effective, treatments must be started within a few days of the symptom onset. SMH is a key member of the Sarasota County COVID Therapy Coalition, which is helping people access the right treatments at the right time. You have a webpage in front of you and it contains great information about testing and treatments. New podcast focuses on rehabilitation. Sarasota's new HealthCast features one of our rehab physicians discussing both inpatient and outpatient rehabilitation, and a new physical medicine and rehab clinic at SMH at the Sarasota Memorial. The podcast series interviews with an array of SMH experts, and I would invite everyone to go to that website or go to your podcast provider on your smartphone and listen to these. I find that they're very good and well done. And Madam Chair, that is my report. I'm happy to answer any questions.
Any questions? No? Well, thank you, David, for that report. We're very proud of our SMH and all the new things that are happening. Next on our agenda then is our consent agenda, and there is nothing to report there. Next, we have the public comments. Are there any public comments? Karen?
No, they're not.
No, there is not. Okay, thank you. And then we have our legal matters with Carol and Kalish.
Thanks so much. Today I'm going to be asking the board, if you're so inclined, to make a motion to ratify the appointment of Jim Fiorica as the system's patient safety officer. As you all know, Sarasota Memorial Healthcare System is committed to providing the highest quality of patient-centered, patient-safe care. And in furtherance of that, David Berenger has recently appointed James Fiorica as the entire system's patient safety officer. In that role, his responsibilities will include working collaboratively with quality, performance improvement, and risk management staff, as well as the medical staff, nursing, and other departments to implement effective, reliable care practices, putting in systems and processes to anticipate and mitigate human error, supporting and facilitating the implementation of systems that eliminate patient harm, assessing the culture for safety and acting to close any gaps, and focusing strategy on reliability, accountability, and continuous learning. As I said, David recently did that on the 18th of May of 2022, and again, the board is so inclined, knowing that quality comes from the top. If someone could have a motion to ratify that appointment.
We have a motion. Do we have a second? And a second. Hearing we have a motion and a second. All those in favor say yes. Yes. Any opposed? Hearing none, motion passes. Thank you, Caroline, for that. Is there any other business to be discussed from anyone? Hearing none, then having completed our agenda, we do stand adjourned. Thank you everyone for your attention.